The differential for vaginal bleeding is simply too large to cover in one video. We've broken this video up into multiple segments. In this initial video, we're going to go over an initial differential diagnosis for vaginal bleeding by age, and then cover a difficult topic in the premenarcheal age group. Let's start off by building that differential. We're going to see our familiar timeline, breaking a woman's life up into premenarcheal, postmenopausal, and reproductive. Identifying that the only time it is normal for a woman to bleed is during her reproductive age group. In a premenarcheal girl, vaginal bleeding may occur for a number of reasons. The most common is a foreign body. Most common. Also look for sexual abuse. Some rarer things that you should be aware of, though, are precocious puberty, and sarcoma botryoides. Except for precocious puberty, all of these can be diagnosed by a speculum exam. But a speculum exam for an 8-year-old might be terrifying, so make sure you do that speculum exam under anesthesia. Which means that this becomes a very invasive and difficult procedure to rule out some simple things. In the postmenopausal female who's having a vaginal bleed, it is endometrial cancer until proven otherwise. The most common cause of postmenopausal bleeding is vaginal atrophy, especially after sexual intercourse. But you can't miss endometrial cancer. And don't forget about hormone replacement therapy, essentially replacing the hormone she loses by being postmenopausal. But bleeding in the reproductive age group is not abnormal. So you only have to go looking for problems in the reproductive age group when there is abnormal uterine bleeding. That is, when someone has too much blood during her cycle, menorrhagia, or has bleeding in between her cycles, metrorrhagia, or both, menometrorrhagia. In these instances, the most common cause of vaginal bleeding actually is pregnancy. Don't forget about anatomy, such as fibroids. And then, if all else fails, dysfunctional uterine bleeding. Begin the workup of a reproductive age female with a urine pregnancy test. And because you wanted to rule out endometrial cancer in the postmenopausal bleeder, do so with endometrial sampling. You're going to see how some of these categories expand into even deeper differentials in future videos. But right now, I want you to recognize that if someone is having a vaginal bleed, and it is life-threatening or severe, you have certain therapeutic options. The treatment for a severe vaginal bleed right now is IV estrogen. It turns off the bleed. And recognize also then that you can use oral contraceptives to control bleeding during people's cycles. But if medical therapy fails, you may need to go to surgery. And this is in the emergent acute situation where IV estrogen hasn't worked. Now you need to go in to do an XLAP and start ligating arteries. And maybe even removing the uterus altogether. You'll see this in the postpartum hemorrhage lecture in pelvic anatomy. This is an overview for all vaginal bleeding in all different age groups. We're going to specifically focus on the premenarcheal age group in this lecture. First, I want you to recognize that foreign body, sexual abuse, and sarcoma botryoides are going to be diagnosed by a speculum exam under anesthesia. You're going to see the things that are typical for each condition. For a foreign body, you're going to see the foreign body. For sarcoma bacteroides, you're going to see the cancer. And for sexual abuse, you're going to see signs of sexual trauma. In addition, you might find an STD. The identification and treatment of those diseases is not difficult. What I want to do is spend some time on precocious puberty because that is difficult to understand conceptually, and it'll be the only one we're going to talk about in the vaginal bleeding series. So let's talk about precocious puberty. That is puberty that is occurring too early. The onset of puberty occurs in very easily identifiable steps. The politically correct ways of writing it is breasts at 8, axillary hair at 9, a growth spurt at 10, and onset of menarche at 11. This is the earliest that these events can occur. OB taught me once, in order to remember this, it's tits, pits, mitts, and lips, and the order that things develop in this predictable pattern, such that if she undergoes early menarche, that is, she begins to bleed because she's been through puberty, she will have missed her growth spurt and may stay much smaller than she could have been, which is the danger of precocious puberty. This process, up until age 11, occurs in a predictable pattern and is based on levels of estrogen. Estrogen levels stay low and then rapidly rise up to the point of bleed. And once estrogen meets a point of maximal intensity is when she first has her bleed. So the idea is that this is all about estrogen. And estrogen has to come from somewhere. So let's take a look at the hypothalamic pituitary axis to better understand the different potential causes. The hypothalamus stimulates the anterior pituitary, stimulates the ovaries to stimulate the endometrium to bleed. The hypothalamus uses GnRH. Anterior pituitary secretes FSH and LH. The ovaries secrete estrogen and progesterone. So you can see at each level there would be some sort of hyperfunctioning of any of the enzymatic pathway that leads to the production of an androgen that causes the endothelium to develop. There's not really any dysfunction of the hypothalamus. If there was one, it's usually to decrease GnRH, not increase it. But the anterior pituitary, although it's rare, may have a tumor that secretes FSH and LH before her body is ready for it. Likewise, the ovary might have a cyst or a tumor, in particular a granulosa theca tumor, which can produce extra estrogen before the axis is even turned on. This will ultimately result in her bleeding. But also, don't forget that androgens can come from the adrenal glands, completely independent of this axis, and still stimulate the endometrium. This is the case of an adrenal tumor that secretes androgens, or in the case of congenital adrenal hyperplasia. I want to point out that an FSH-LH secreting tumor and an adrenal tumor that secretes androgens are extremely rare, in that masses in these areas are generally something else. So what you want to be able to do is spot a person, spot a girl, before she undergoes menarche and has her first bleed too young. You want to spot her before she has her growth spurt or that growth spurt gets cut off. So what you want to do is monitor girls for early breast development. The entire process is based on estrogen, and estrogen levels begin to rise, inducing breast development. So if someone comes in who has early onset secondary sex characteristics, that is before the age of 8 years old, you want to begin the workup for precocious puberty. If you've caught her at menarche, it's already too late. The first step is to get a wrist x-ray. You want to determine her bone age. And for the sake of this lecture, it's going to be positive. It's positive if the wrist age is 2 or more years ahead of her chronological age. It demonstrates that puberty is well underway and that there is rapid growth. We're going to assume it's positive for this discussion. The next step is to decide, is it a problem within the axis or is it in the periphery? Is it central or peripheral? You do that with the GnRH stimulation test, also called a leuprolide stimulation test, because leuprolide is GnRH. If there is an elevation in the luteinizing hormone, it is a central process. Whereas if there is no increase, it is a peripheral problem. If it's a central problem, you want to know, is it a pituitary tumor or not? And since it's a central problem, the best way to investigate a brain is an MRI. You spare her radiation burden and you get the best picture with an MRI. And what you'll see is either there will be a tumor, and this tumor is potentially dangerous to her development, so requires resection, or you will see nothing. And if you see nothing, it is constitutional. This does not warrant reassurance. You still don't want her undergoing menarche too young, but this is happening in the urban environment. We presume because of something to do with the food or the environment, we're not really sure, but girls are undergoing puberty younger and younger. It's considered constitutional, but you also want to give her a chance to develop. So by doing that, you can give her leuprolide continuously. This will shut off the axis, give her a chance to grow, and then when she reaches the appropriate age, remove the stimulation, and her axis continues to develop. If, however, that stim test was negative and it's a peripheral condition, now you have to go hunting, because androgens are being produced independent of the axis. So what you do is look everywhere. You're going to get an ultrasound, not a CT because it's a child. You're going to get an ultrasound of the abdomen, looking at the ovaries to see if they're producing excess testosterone. You can also get a testosterone level. You're going to get an ultrasound of the adrenals to see if you can find a mass, because they produce DHEAS. And if you're worried about congenital adrenal hyperplasia, you get a 17-hydroxyprogesterone in the urine. You sort of do this all at once unless you were directed by a particular sign or symptom that points you in a certain direction. If it's congenital adrenal hyperplasia, you give her the steroids that she needs. We talk more about this in the virilization lecture, but essentially congenital adrenal hyperplasia is the overproduction of DHEAS because she has no cortisol or aldosterone. The body tries to make more of those, but instead of making them because of deficiency of 21-beta hydroxylase, it shunts all the cholesterol into androgens. If it's a tumor, no matter where it is, in the ovary or the adrenal, you resect it. And if there is a cyst on the ovary, this is the only time where you can consider reassurance. You simply observe it, and it is likely to resolve on its own, unless it is complex, and then you should cut it out. So in this lecture, what we've done is we've done an overview of the different causes of vaginal bleeding by age. We've briefly mentioned some of the pediatric diseases that can cause vaginal bleeding, which we'll likely see more of in the pediatric lectures. And most importantly, we've gone through precocious puberty. The goal of precocious puberty is to catch the girl who's developing too early before she bleeds. That way you protect her growth spurt and let her develop normally with your intervention. That is the first segment of vaginal bleeding. We make these videos for free, and we need your help. Please donate, because without your donations, we can't make any more videos. Please donate.